China's surge in respiratory illness is caused by known pathogens and there is no sign of new infectious diseases, a health official said Saturday as the country faces its first full winter since lifting its strict COVID-19 restrictions. The spike in illness in the country where COVID emerged in late 2019 attracted the spotlight when the World Health Organization sought information last week, citing a report of clusters of undiagnosed pneumonia in children. Chinese authorities will open more pediatric outpatient clinics, seek to ensure more elderly people and children receive flu vaccines and encourage people to wear masks and wash their hands, Mi Feng, an official with China's National Health Commission, told a press conference. Doctors in China and experts abroad have not expressed alarm about China's outbreaks, given that many other countries saw similar increases in respiratory diseases after easing pandemic measures, which China did at the end of last year. On Friday, 5 Republican senators led by Marco Rubio asked President Joe Biden's administration to ban travel between the United States and China after a spike in Chinese respiratory illness cases. A Biden administration official said the United States was closely monitoring the uptick in respiratory illnesses in China, but added, "We are seeing seasonal trends. Nothing is appearing out of the ordinary. At this time, there is no indication that there is a link between the people who are seeking care in U.S. emergency departments and the outbreak of respiratory illness in China." Maria Van Kerkhove, acting director of the WHO's Department of Epidemic and Pandemic Preparedness and Prevention, said earlier this week the increase appeared to be driven by a rise in the number of children contracting pathogens that they had avoided during 2 years of COVID-19 restrictions. The spokesperson for the Chinese embassy in Washington, Lu Pengyu, said in response to the Rubio letter, the relevant claims are purely ill-intentioned fabrications. China firmly opposes them. Rubio's letter was also signed by Senators J.D. Vance, Rick Scott, Tommy Tuberville and Mike Braun. Beijing is racing to identify a new illness that has sickened 59 people as it tries to calm a nervous public. For days, Li Bin had what felt like a cold, with a high fever of between 102 and 105, and he could not understand why he wasn't getting better. After 4 days, he went to a hospital, and a doctor told him he had a form of viral pneumonia, without offering specifics. Mr. Li, 42, was hospitalized, then transferred to another facility and quarantined with other patients who had similarly unexplained symptoms. Mr. Li is one of 59 people in the central city of Wuhan who have been sickened by a pneumonia-like illness, the cause of which is unclear. The cases have alarmed Chinese officials, who are racing to unravel the mystery behind them in a region where the memory of an outbreak of the dangerous respiratory disease known as SARS remains fresh. SARS originated in China and killed more than 800 people worldwide in 2002 and 2003. At the time, the Chinese government tried to cover up the problem, which is exacerbating fear now about this new illness. Symptoms of the new illness include high fever, difficulty breathing and lung lesions, the Wuhan Health Commission has said. No deaths have been reported but 7 people are critically ill. On Sunday, the city government said they had ruled out as causes SARS, the Middle East respiratory syndrome, bird flu, and the adenovirus. The illness appeared just weeks before the Spring Festival, the country's biggest holiday, when tens of millions of people travel. The authorities urged the public to be on alert for pneumonia-like symptoms like fever, body aches and breathing difficulties. Workers wearing hazmat suits disinfected and shut down the Huanan seafood market in Wuhan, which also sold poultry, pheasants, and wild animal meats, after the city health department said it traced many of the cases to it. Viruses that caused SARS and the H7N9 strain of bird flu in humans were first detected in markets that sold animals, and experts have said contact with infected animals was the likeliest source of transmission. Health authorities around the region have responded quickly. In Hong Kong, 21 people who had visited Wuhan in recent weeks were hospitalized between December 31st and noon on Monday, according to that city's health department. Officials said they would install additional thermal imaging systems at the international airport to monitor passengers coming from Wuhan. They also added staff at the high-speed rail station to check body temperatures. The authorities in Singapore placed a Chinese girl with pneumonia in isolation because she had traveled to Wuhan, then said on Sunday that doctors had found that the child had a common childhood viral illness. Chinese health officials at first appeared to be closely guarding information about the illness. The Wuhan government confirmed on December 31 that health authorities were treating dozens of cases of pneumonia of unknown cause only after an emergency notice to city hospitals was shared on social media sites a day earlier, apparently triggering some public panic. But more recently, the government appeared to be moving more quickly to disclose information about new cases in a sign that it has learned its lesson from SARS, said Leo Poon, a public health expert at the University of Hong Kong. I have to emphasize this is a new disease, and no one on Earth has gone through this before, he said. Mr. Poon said a surge in cases in the coming week would suggest either that the source of the virus had not been eradicated despite the shutdown of the market or that the illness could be transmitted between humans. I hope this pathogen is a less harmful one so it would not cause a major epidemic similar to SARS, he said. It would be a nightmare for all of us. Wang Linfa, an expert on emerging infectious diseases at the Duquesne U.S. Medical School in Singapore, said he was frustrated that scientists in China were not allowed to speak to him about the outbreak. Dr. Wang said, however, that he thought the virus was likely not spreading from humans to humans because health workers had not contracted the disease. We should not go into panic mode, he said. The World Health Organization said it was closely monitoring the situation and was prepared to mount a broader response, if needed.